Hello, knock knock. Okay, pull in the drapes. Hi there, my name is Andy, and I'm gonna be your student nurse today. How are you doing?
I'm good, how are you?
Good. Can you tell me your name?
My name is Henry Sim.
Great. And can you tell me your date of birth?
December 5th, 1995.
Awesome. And MR number looks good against the chart. Everything looks good. Henry, do you know why you're here today?
I'm here for a physical assessment.
Awesome.
For work.
Great. And do you know where you are?
I am here at PCC Hospital.
Awesome. And do you know where you, what date it is today?
It's December 1st, 2021.
Okay, awesome. So I'm just gonna do a normal head-to-toe assessment before the doctor comes in and do your physical assessment.
Okay.
Is that okay?
Yes.
Okay, great. So from that, my patient is ANO times 4, and at this point, I would obtain the vital signs. So radial pulse is 86 plus 2 with a regular rate and rhythm. Respirations are 17 with equal chest rise and fall. The patient doesn't appear labored with breathing. SpO2 is 98%. Blood pressure is 116/78. And Henry, are you in any pain right now?
Yeah, I do have some pain on my thigh.
On your thigh? Okay. Can you tell me which thigh you're having pain in?
It's my right thigh.
Your right thigh?
Yeah.
Okay. And when did this pain start for you?
A few days ago.
Okay. And can you tell me what it feels like? Is it sharp or dull or achy?
It's a bruise I got when I was playing basketball with my friends.
Got it. And on a scale of 0 to 10, with 10 being the worst pain you've ever had, can you give me a rating of how bad it is right now?
It's like a 3 right now.
Okay, all right. And does anything make it worse or anything make it better?
Yeah, if I press on it, it hurts, but then if I put some ice on it, it helps.
Okay, sounds good. I'll go ahead and take a look at that when we do your exam real quick, okay?
Okay.
And the last thing is I obtained oral temperature, and that's 98.6. So all the vital signs are within normal limits. All right, Henry, I'm just gonna raise the head of your bed, okay?
Okay.
I'm gonna raise that to 45 degrees. Okay, so we're literally gonna go from head to toe, okay?
Okay.
All right. So first, I'm gonna check your. I'm gonna shine a light into your pupils, okay? Great. Once more. Great. Great. Can I have you focus on the tip of the pen light? Great. And can I have you focus on the projector right there? Great. Okay, so pupils are pearl, so they equal round and reactive to light and accommodation. And they are about 3 millimeters. Okay. Now I'm gonna do a quick check of your scalp. So everything looks good. There's no erythema or lesions or lumps. There's no dryness, and there's no infestations present. Head is normocephalic. Do you wear any glasses or hearing aids?
No.
Okay, great. I'm gonna pull it down real quick. Conjunctiva are pink, sclera is white. And at this point, I would assess the nares if the patient didn't have a mask. I would have you plug your nose and take a deep breath. So your nares look patent, and I would use a pen light to check. So the patient has a good airway. And can I have you open your mouth? Okay, so the uvula is, can I have you say ah?
Ah.
Great. Okay, the uvula is midline, teeth are intact, and the mucous membranes are pink and moist. Okay, I'm also gonna check your ears. Okay, there's no redness or drainage present. Do you have any environmental factors that could have, like loud noises where you work or anything?
No. It's not
Okay,
this.
everything looks good. So the bed's at a 45-degree angle, and now I'm gonna assess the neck. So the trachea is midline, and there's no jugular vein distension. Okay. I'm gonna feel your carotid pulse. Great. +2 bilaterally, and with a normal rhythm. Okay, now I'm going to check your skin turgor. So I'm going to pinch lightly. Okay, there's no tenting, and skin temperature is warm with pink undertones and good color. So that's a sign of good hydration. Okay. Now I'm gonna listen to your lung sounds, okay?
Okay.
So every time I put my stethoscope against your skin, just go ahead and take a deep breath for me, and just tell me if I'm going too fast, okay? I'm gonna listen to your back as well. Can I sit up? Yeah. All right, so same thing. Okay, and the last part is gonna be in the right middle lobe. Okay, great. So lung sounds are clear bilaterally with no adventitious breath sounds noted. Okay, and now I'm actually gonna listen to your heart sounds. Okay, so for this, you can just breathe normally, okay?
Okay.
Okay, S1, S2 is normal with no murmurs. And I'm gonna lay you down and take your apical pulse for a full minute, okay?
Okay.
Yeah, so it's gonna take a minute, so you can probably close your eyes and take a nap or something. Okay, so 5th intercostal space, midclavicular. So apical pulse was 72 with 72 in regular. Okay, I'm gonna sit you back up. Just for a bit, and now I'm gonna assess your upper extremities, okay?
Okay.
All right, so everything looks good, skin signs are uniform. Okay, capillary refill. It's less than 3 seconds. Check your radial pulses, +2 bilateral, and cat refill is less than 3 seconds in this hand too. Okay, great. And now I'm actually going to have you squeeze my fingers if you can. Okay, great. And go ahead and press against my arm. Okay, now pull it. Okay, great. And go ahead and raise your legs against my hands. Okay, upper and lower extremities, the strength is 5 out of 5. And now I'm gonna go ahead and assess the abdomen. So upon inspection, I would have this, the patient's abdomen exposed at this point, and I don't see any edema or any swelling, and the skin sign looks good. I'm gonna listen to your bowel sounds, just to make sure that they're all there. And I'm using the umbilicus as a midline. All right, bowel sounds in all 4 quadrants, everything is normal. And I'm gonna palpate and just let me know if there's any pain, okay?
Okay.
Everything feel okay?
Mm-hmm.
Okay, so there's no grimacing, no guarding, there's no rebound tenderness, I don't see any abdominal rigidity, and there's no pulsating mass, so everything looks like it's normal. And now we're gonna actually go down to your legs. So I'm gonna have you, actually I'm gonna check for cat refill. So less than 3 seconds here, less than 3 seconds here. I'm gonna take your pedal pulses, and they're +2 bilaterally and normal. And I'm gonna have you raise the legs right here, just like that. And I'm gonna check for calf, if there's any edema present. Okay, there's no edema, there's no swelling or redness, no signs of DVT or thrombosis, so everything looks good. Okay, and I'm actually gonna have you turn to your side so I can take a look at your back. So, on all the bony prominences, the back of the head, the occipital area, everything looks fine. The neck, the sacrum, the coccyx, the elbows, I don't see any redness or signs of pressure injury. And everything looks good down the legs and the heels as well. So great, you can turn back over. Awesome. Okay, so I think we're all finished, and I'm gonna go ahead and put your side back up and put you back in a comfortable position. In case you need anything before the doctor comes in, the call is right here, okay?
Okay.
And do you have any questions for me right now? Okay, great. Okay, the bed's locked. I'm gonna put the bed in the last position. Take off my gloves, perform hand hygiene, and I'll do my documentation at this point. Okay, and everything's done.